I want to tell you something that I have never seen printed on the back of a firming cream. And after 15 years of examining women's skin in a clinical setting, I can tell you it should be. Your legs are not losing tone because of aging. They are losing tone because 3 separate systems inside the skin are failing at the same time, and every product you have been sold addresses exactly none of them. Here is what those 3 systems actually are. At the surface, you have the epidermis, just the protective outer shell, the layer every cream reaches and stops at. Below that is the dermis, the living structural layer where collagen fibers give the skin its firmness, and elastin fibers give it its rebound, its ability to return to position after being stretched or pressed. Below the dermis is the hypodermis, the fat and connective tissue base that gives the skin something stable to sit on from underneath. And running through all 3 of these layers is a network of lymphatic channels and blood capillaries that supply oxygen, remove waste, and keep every skin cell in those layers alive and functional. Now here is what happens after 50, and I want you to hear this as one connected chain, not as separate problems. Estrogen declines and the collagen fibers in the dermis begin thinning. Circulation slows and the blood capillaries delivering nutrients to the skin narrow. Lymphatic flow decreases and waste that should be cleared from the tissue begins accumulating instead, which is what I call dermal lymphatic decoupling, and it is the piece almost no one explains. I want you to picture the whole system like a suspension bridge. The collagen is the cables holding the structure taut. The lymphatic channels are the drainage system running beneath the road surface. The blood capillaries are the fuel lines along the sides. When estrogen drops, the cables thin. When you sit for long periods, the drainage backs up. When circulation declines, the fuel lines narrow. And a bridge with thinning cables, blocked drainage, and narrowed fuel lines does not fail at one single point. It fails across the entire span, slowly and visibly, which is exactly what you are seeing on your legs right now. The genuinely good news is that each of those 3 failure points is specific, identifiable, and correctable, and everything your legs need to begin that correction is already in your kitchen. Root factor 1, chronic lymphatic stagnation. The first factor is one that almost no one talks about in the context of skin aging, and when I tell you what it is, your first thought is going to be that it sounds too simple to matter. The first root factor is lymphatic stagnation in the lower limbs. I can already hear the objection. I don't have lymphedema, I'm not swollen, this isn't a circulation problem. My legs just look old. And that is precisely the misunderstanding I want to correct right now. You do not have to have visible swelling for lymphatic stagnation to be destroying your skin's architecture. Subclinical lymphatic congestion simply means low-grade fluid pooling that hasn't yet become visible edema, creates a constant outward pressure against the dermis from the inside. It is like slowly inflating a balloon inside a mesh bag. Over time, the mesh stretches, the fibers separate, and the structure loses its ability to spring back. One landmark study published in the Journal of Cosmetic Dermatology found that women with sedentary occupations showed measurably greater dermal fiber separation in the thighs and lower legs compared to age-matched controls. And the primary driver was not hormonal. It was postural fluid accumulation. Common treatments, firming lotions, collagen creams, fail here because they address the surface of the mesh bag while the balloon inside is still inflated. You cannot firm skin that is being stretched from underneath. The solution is dry brushing. Use a natural bristle brush, available at any pharmacy or grocery store for under $10. Every morning before your shower, brush upward from ankle to hip in long, firm strokes, 3 minutes, both legs, upward only. This mechanically stimulates the superficial lymphatic vessels and begins moving that stagnant fluid back toward the lymph nodes of the groin, where it belongs. 3 minutes, every morning, before the water touches your skin. The next factor is something that virtually every woman over 50 is deficient in, and it has a direct line to why your legs specifically, not your face, age faster. And it is probably in your refrigerator right now. Root factor 2, collagen substrate deficiency. Here is a question that almost no one asks. If collagen loss is the same problem all over the body after menopause, why do the legs look so much older than the face? The answer is collagen substrate deficiency. Simply means the body lacks the raw building materials needed to synthesize and maintain collagen, and the legs bear the worst consequences because they receive the least nutritional blood supply per square centimeter of skin. The objection I hear most is, I take a collagen supplement, so I'm covered. I understand why that seems logical, but here is the biological reality. Collagen is a protein, And like all proteins, it requires cofactors to be built and maintained. The two most critical cofactors for dermal collagen in postmenopausal women are ascorbic acid, simply means vitamin C, and orthosilicic acid, simply means the bioavailable form of silica. Without adequate levels of both, your body cannot lay down new collagen fibers regardless of how much collagen powder you consume. Research published in the American Journal of Clinical Nutrition demonstrated that women with low dietary vitamin C had 11% lower dermal collagen density compared to age-matched women with adequate intake, and that gap widens after menopause. Common treatments fail here because the supplement industry sells you the finished product, collagen, without supplying the construction tools. It is like delivering bricks to a building site with no mortar and no scaffolding. The solution is elegantly cheap. One medium green bell pepper, not red green, contains 128 milligrams of vitamin C per 100 grams, which is more than an orange and more than most supplements. Eat one every day, raw if possible, as part of a meal. Alongside that, add 1 tablespoon of raw apple cider vinegar in a glass of warm water every morning. Apple cider vinegar increases the bioavailability of silica from the plant foods in your diet, meaning you extract more of the mineral your skin needs from the food you are already eating. 1 green pepper, 1 tablespoon of vinegar, daily. That is the entire intervention. If you are finding this information genuinely different from what you've seen elsewhere, please subscribe right now. Because every single video on this channel is built on the same clinical depth, not on trends or sponsored products. Root factor 3, cortisol-driven collagen catabolism. This next factor is the one that most surprises women when I explain it in a clinical setting. Because the visible symptom is on their legs, but the driver is in their stress response system. The third root factor is cortisol-driven collagen catabolism. Simply means the chronic stress hormone cortisol is actively breaking down collagen faster than the post-menopausal body can replace it. The objection here is always, I'm not particularly stressed, I don't feel anxious all the time. And this is where I need you to understand something important. After menopause, cortisol regulation changes structurally. The suppressive effect that estrogen had on the cortisol stress axis, the HPA axis, simply means the hormonal feedback loop between the brain and the adrenal glands, is removed when estrogen drops. This means that the same daily pressures that your body once buffered hormonally are now producing a measurably higher cortisol output. You do not feel more stressed. Your cells are more stressed. There is a significant difference. A randomized controlled trial published in the Indian Journal of Psychological Medicine found that participants taking ashwagandha root extract showed a 27.9% reduction in serum cortisol levels over 60 days compared to placebo. Standard skincare fails here entirely because no topical product can intercept a systemic hormone signal. You cannot moisturize your way out of a cortisol problem. The solution is ashwagandha root powder, available at any health food store or large grocery store, typically under $12 for a month's supply. Take half a teaspoon stirred into warm whole milk or warm oat milk every night before bed. The fat content of the milk increases the absorption of the active compounds, the withanolides, that drive the cortisol-lowering effect. Do this every night, not intermittently. The research effect requires consistent dosing over a minimum of 4 weeks. Half a teaspoon, warm milk, every night. The consistency is the medicine. The next factor is invisible, has no obvious symptom on its own, and is responsible for something I call the silent oxygen debt in your leg skin. And once you understand it, you will never take a hot shower the same way again. Root factor 4, impaired peripheral microcirculation. Your face gets more blood than your legs. That single fact explains more about the age gap between your face and your legs than almost anything else. And almost no one in the skincare world talks about it. The fourth root factor is impaired peripheral microcirculation. Simply means the small blood vessels supplying the skin of the legs have reduced flow, creating a chronic state of low oxygen delivery to the dermal cells. I know what you're thinking. My circulation is fine, I walk regularly, I don't have vascular disease. And you may be absolutely right about all of that. But here is the physiology. Even in a healthy circulatory system, the legs are the furthest vascular territory from the heart. After 50, peripheral vascular resistance simply means the degree of natural narrowing and stiffening in small blood vessels increases measurably as part of normal aging. A study in the Journal of Applied Physiology found that peripheral microvascular reactivity, the skin's blood vessels' ability to dilate in response to stimulus, declines by approximately 40% between the ages of 25 and 65. Your leg skin cells are working with less oxygen, less nutrient delivery, and slower waste removal than they were 15 years ago. Most firming treatments fail here because they are topically applied and cannot reach the microvascular level. A cream sits on the epidermis. The oxygen problem is happening in the dermis and below. The solution is contrast hydrotherapy during your daily shower, and you are already in the shower, so this costs nothing. After you wash normally, alternate the water temperature on your legs only. 30 seconds of water as warm as is comfortable, then 30 seconds of water as cold as you can tolerate. Repeat that cycle 5 times without stopping. This thermal alternation acts like a pump on the peripheral blood vessels. Warm dilates, cold contracts, and the repeated cycling forces a mechanical increase in microvascular flow that persists for hours after the shower ends. 30 seconds warm, 30 seconds cold, 5 cycles. Every shower, no equipment, no cost, measurable result. The fifth and final root factor is one that women with very dry legs already know something is wrong, but they have been treating it in a way that makes it worse, not better. Root factor 5. Transepidermal water loss and lipid barrier collapse. Of all 5 factors, this one produces the most immediately visible result when corrected. And it is also the one that most women are currently managing in the single worst possible way. The fifth root factor is transepidermal water loss combined with lipid barrier collapse. Simply means the skin of the legs is losing moisture through the surface faster than it can hold it, because the protective fat barrier that seals water inside the skin has deteriorated. The objection I always hear is, I moisturize every day, I use a good lotion, this isn't my problem. Here is the physiology that makes that a painful irony. The skin below the knee contains almost no sebaceous glands, simply means the microscopic oil-producing glands that naturally waterproof skin, which makes the lower leg the fastest dehydrating skin surface on the entire human body. After menopause, the ceramide content of the skin barrier simply means the fat molecules that act as the mortar between skin cells drops by up to 40%, according to research published in the British Journal of Dermatology. And here is the key that most moisturizer marketing hides from you. Applying lotion to fully dry skin seals in almost nothing because there is no water present to trap. You are lubricating a dry surface, not hydrating living tissue. Standard lotions fail here because they are applied incorrectly, at the wrong time, on the wrong skin state. The delivery method is the failure, not the concept. The solution uses 2 ingredients that cost almost nothing. Immediately after your shower, within 3 minutes before the surface moisture evaporates, apply a small amount of pure coconut oil, about half a teaspoon per leg, directly to still damp skin. Add a pinch of turmeric powder to the coconut oil before applying. Turmeric contains curcumin, simply means the active anti-inflammatory compound, which at topical application has been shown to support ceramide synthesis in the skin barrier. The damp skin gives the oil something to seal in. This is not moisturizing. This is barrier reconstruction. Half a teaspoon of coconut oil, a pinch of turmeric applied to damp skin within 3 minutes of leaving the shower. That 3-minute window is not optional. It is the mechanism. Practical protocol. Now let me give you the complete system. Not a list of separate tips, but a single integrated protocol where each element amplifies the others. This is 4 weeks of structured work, and by week 4, everything runs as one seamless daily routine. Week 1, lymphatic and circulatory reset. This week you do 2 things only, and you do them every single day without adding anything else. In the morning, before your shower, dry brush both legs for 3 full minutes, ankle to hip, upward strokes only, firm pressure. Then in the shower, finish with 5 contrast cycles on the legs. 30 seconds warm, 30 seconds cold. Nothing else changes this week. The goal is to begin moving stagnant fluid and reawakening the peripheral microvascular response before you introduce any internal interventions. Do not skip days. The lymphatic system responds to rhythm. Week 2, internal substrate loading. Keep everything from week 1 running. Now add 3 internal inputs. Every morning, drink 1 tablespoon of raw apple cider vinegar in a glass of warm water before breakfast. At some point during the day, eat 1 medium raw green bell pepper, sliced into a salad, eaten with hummus, however works for you. Every night before bed, stir half a teaspoon of ashwagandha powder into warm milk and drink it within 30 minutes of lying down. These 3 internal interventions address collagen substrate deficiency and cortisol catabolism simultaneously. Week 3, topical barrier reconstruction. Keep everything from weeks 1 and 2. Now add the post-shower barrier repair. Within 3 minutes of leaving the shower, apply half a teaspoon of coconut oil mixed with a pinch of turmeric to each leg on still damp skin. Also add the evening leg elevation practice, 10 minutes lying on your back with both legs raised straight up against the wall before bed. This is the bonus technique, and it is profoundly effective. Gravity has been pulling fluid into your legs all day. 10 minutes inverted against a wall drains it passively, decompresses the dermis from that internal pressure, and prepares the tissue for the overnight repair cycle that occurs during deep sleep. Week 4, full system integration. Plus weekly deep treatment. All elements from weeks 1, 2, and 3 now run simultaneously as your permanent routine. Add 1 weekly deep treatment on a day of your choice. Mix 2 tablespoons of finely ground coffee with 1 tablespoon of coconut oil into a paste. Apply to the legs in upward circular motions for 5 minutes, then rinse. Coffee grounds provide mechanical exfoliation that removes the dead ceramide-depleted surface cells, while caffeine in the coffee temporarily constricts superficial blood vessels in a way that creates a measurable tightening effect, and the mechanical motion drives an additional lymphatic push, once per week. That is the only addition. This is not a list of 5 separate things. It is one system where lymphatic drainage creates the space, microcirculation delivers the oxygen, the internal nutrients provide the building materials, the cortisol reduction stops the demolition, and the barrier repair seals the results in place every night. Now, I want to come back to the age question I asked you at the beginning, because I was not being casual about that. If you are in your mid-40s, around 45, the most urgent issue in this protocol for you is the cortisol factor. Perimenopause is actively beginning to destabilize your HPA axis, and the collagen breakdown from elevated cortisol is accelerating even though your estrogen has not fully withdrawn yet. Your priority this week is the ashwagandha. If you are in your mid-50s, around 55, the most urgent factor for you is the collagen substrate deficiency combined with the lipid barrier collapse. Your estrogen withdrawal is complete or nearly so, and your dermal ceramide levels are in active decline. Your priority is the green pepper, the vinegar, and the 3-minute post-shower window. If you are in your 60s, 60 and beyond, the most urgent factor is microcirculation. Peripheral vascular resistance has compounded for a decade, and your leg skin is operating in the deepest state of oxygen debt of any age group. Your priority is the contrast shower, performed every single day without exception. So drop your age in the comments below. I read these. And the age you leave is a clinical anchor point. It tells you which part of this protocol to treat as non-negotiable versus supportive. There are 5 root factors driving why your legs look older than your face, and each one has a direct, cheap, measurable correction. Factor 1 is lymphatic stagnation, corrected by daily dry brushing upward from ankle to hip for 3 minutes before showering. Factor 2 is collagen substrate deficiency, corrected by 1 raw green bell pepper daily and 1 tablespoon of apple cider vinegar in warm water every morning. Factor 3 is cortisol-driven collagen catabolism, corrected by half a teaspoon of ashwagandha in warm milk every night. Factor 4 is impaired peripheral microcirculation, corrected by 5 contrast hydrotherapy cycles in your daily shower. Factor 5 is lipid barrier collapse and transepidermal water loss, corrected by the 3-minute post-shower coconut oil and turmeric application to damp skin. Together, these 5 corrections form a single biological system, one that addresses the architecture of leg skin aging from the inside out, from the deepest vascular layer to the outermost surface, simultaneously and in the correct sequence. That is not a routine. That is a repair. One important clinical note before you go. If you notice sudden unilateral swelling in one leg only, skin that is warm, red, and tender to the touch, or visible cord-like structures along the inner thigh or calf, please seek immediate medical evaluation. These can be signs of deep vein thrombosis, which requires urgent clinical assessment and is outside the scope of any self-care protocol. This protocol supports your body's natural lymphatic, vascular, and dermal repair functions. It does not replace the evaluation of a licensed medical professional. And if you have a known vascular condition, please consult your physician before beginning. No clinic will offer you what I just gave you today. There is no billing code for dry brushing, no procedure fee for a cold shower, no prescription pad for a green pepper. The system I just described generates no revenue for anyone, which is exactly why no one tells you about it. This channel exists for one reason: to give women over 50 the clinical truth about their own bodies without a product attached to it. I am Dr. Elena Voss, and I have spent 15 years watching women treat the surface of a structural problem. That ends here. Your legs are not failing you. They are sending you a A specific, readable, correctable signal. And now you know how to answer it. If this video gave you something real today, please share it with one woman in your life who needs correct information more than she needs another cream. That share costs you nothing and it might change everything for her. Subscribe if you haven't yet. I will see you in the next one.